My name is Titus Waititu. I work for Ministry of Health. The NTD focal point for schistosomiasis and soil transmitted helminths, which were the two diseases that were where intervention was being carried out on the prevention of schisto and STH. That is in Kiswahili tunasema kichocho, hiyo ni schistosomiasis, na minyoo, haya ya kawaida yanatukumba. These two diseases are very devastating. They cause a lot of devastation and pain and suffering to most of the inhabitants of this lake region where we are intervening. A disease like schistosomiasis can manifest in two ways, where you have someone urinating blood, and again you can have him have some intestinal obstruction that requires surgeries and can lead even up to death if not treated on time. There's also another area that is usually neglected, female genital schistosomiasis, that usually manifests itself like an STI that is also comes from the disease. The disease is spread by snails. There's a vector. There's a snail that is used as a vector so that you'd imagine the people who get the disease are those who interact with water more, like the fisher folks, children who go and play in the rivers, and the mamas who go and wash their clothes. So those are the at-risk population. Women and children are usually more at risk for schistosomiasis, and for that we do conduct the main key intervention that is prescribed by WHO for schistosomiasis is mass drug administration using praziquantel. Then for the soil transmitted helminths, that is a minyoo, we use mebendazole donated by our pharmaceutical companies. So what we're doing here, we are reviewing and disseminating the results of the mass drug administration that was conducted in the lake region, the 5 lake region counties during the month of December. We want to review the coverages that were achieved by administering those medicines, and also plan for the next cycle of mass drug administration so that our population can be free and we are able to eliminate these two diseases that have really caused havoc in the region for quite a number of years. And apart from that key intervention that I've mentioned of providing medicines to the population that is suffering from the two diseases, there are other ways that the public can do to prevent, and we can help each other to prevent this disease. Provision of water and sanitation is key. Diseases like soil transmitted helminths are spread by open defecation, where people do not use toilets, and you find that they are defecating outside. And also the bilharzia that I've talked about, it's usually spread by urinating probably in the water or defecating in the water. So if we prevent, use behavior change, communication, health education to prevent these vices from happening, will go a long way in preventing these diseases. And others like snail control, malacology, maybe vector control, getting rid of the particular species that is responsible for the spread of Bilharzia. is also another way that can be used to at least control and help eliminate these two diseases from the region. We have at-risk population. We are not distributing to every ward and every sub-county. There's a WHO threshold that is prescribed that once an area is endemic, above 2%, that is the prescribed threshold after a survey. Those are the areas that we are targeting. In the room right now, as you're seeing, is we have representatives from all those sub-counties, all those wards, and they will know, based on the survey that was conducted in 2021, the endemic areas within their areas, and give us a rough population through the census of the number of people in that area. Then we sum up that total. Yes, and also there's a criteria that we use. There are other areas that are hyper-endemic, others are moderate and of low endemicity. Other areas require 2 or 3 rounds in a year. Others you treat after 2 years and after 3 years. That is the kind of work that is being done there, and also planning for the next cycle. So at the end of it, we will get a figure of the number of people we are supposed to treat. Usually around 6 or 7 million. I can estimate around that number in the Lake region. We are planning in Nairobi together with other stakeholders around the month of October, November, just like we did last year. Yes, in the last quarter of this year, we will have started the preparations for the next cycle of mass drug administration in this region. Yes, the disease burden is high, I might say. Higher than most other regions in Kenya, probably due to the lake and the interaction of the people with the lake and the rivers that are also moving across the lake. But we have specific disease burden per implementation unit. Others have achieved the WHO threshold, they are below 2%, but we have areas with around 40%, 30%, 20-something percent, and many areas with over 10% prevalence of schistosomiasis. That is Bilharzia. Yeah. There are things we can do within our power, especially the Kenyan public, the people who are at risk of getting Bilharzia. You can use the toilets well. We can have proper sanitation, and whenever you have the information, you just pass it on to the next person, and it might help. Behavior change communication is important. It's an important pillar in eliminating and getting rid of these diseases from this region. Yeah. And whenever we call upon you to take medication as a preventive chemotherapy, we appeal to the public to turn up in large numbers and take the medicine. That you are not only protecting yourself, you're protecting your neighbor as well. Yeah.
My name is Alice Sereti Sinket. I'm the Executive Director for African Institute for Health and Development. We are an implementing partner under a RISE fund, a RISE 2 fund. We're being supported by NFund in supporting the Ministry of Health, the Neglected Tropical Diseases Unit, in fighting 2 diseases, schisto and Bilharzia, which is Bilharzia and intestinal worms. What we are doing, we are the implementing partner. We also support in work related to social behavior change and communication, where we educate communities to ensure that they adopt good behavior that will lead to elimination of these diseases. Most of these diseases come by because of hygiene issues, wash-related challenges, and we educate the community. For example, washing their hands regularly, wearing the shoes, and just using the toilet to break the transmission of the diseases. So we are not doing this alone as an institute. We work together with other partners. For example, we have CHAI that has been supporting us with data. We also have AMREF that also have been supporting in this venture. What we do is just empower the communities using change agents to advocate for change in behavior, and also just building the capacity of the county teams to be able to break transmission. And we are also talking about sustainability of the gains that we are getting from all this work that we are doing. And we currently advocating for domestic resource mobilization, just to ensure that governments begin to put resources that will ensure that we eliminate these diseases by 2027, according to the breaking transmission strategy in this country, but also according to WHO roadmap that says by 2030 we should eliminate most of these diseases, which are neglected tropical diseases. Thank you. Yes, some of the community activities that are contributing to the spread of the diseases include, for example, the fisher folk. When they are fishing for a long time, they don't have wash latrines, sanitary facilities. So most of the time they go to the lake, and now, they pollute the environment. These kids go to the lake also to swim. We have women washing clothes. So we advocate for use of latrine, but also putting on shoes, because some of the areas here, they do rice irrigation, but also just putting on shoes to protect the spread of the diseases. And washing of hands is another thing. So we advocate for them to put on shoes, to use latrine, and basically avoiding contaminated water bodies. For example, the swimming activities that happen in this region. So those are some of the behavior change communication strategies that we are putting into place.
So I'm Charles Odor. I coordinate neglected tropical diseases. We have some areas, this disease, especially schistosomiasis, you get it where there's water bodies. And also we have the vectors, which are specific snails, the bullinus and Bamflaria. These are specific snails. So where we have these snails, we have a lot of burden. Like if we go to West Timbo, the prevalence is 60%. So in a layman's language, you'll find that 1 in 6 people has that disease. So the burden is very high. So we'll assess after giving these drugs for years, and then we see if the disease is reduced to what level, or if we have eliminated. But we have to reduce it first before we eliminate the disease. So there are some areas where the prevalence is very high, like Bondo sub-county and Rarieda sub-county. But we did granular mapping, and we know the burden of this disease in all the areas in Siaya County. And even now as a county, we are trying to reach them by equipping the facilities next to those areas where the diseases are burdened, so that they are able to get the commodities that can treat these diseases.